I'm Dr. Gregory Buford, board-certified plastic surgeon and founder of Beauty by Buford. One of my favorite procedures is a tummy tuck. Tummy tuck is a variety of things or a variety of procedures aimed at improving the appearance of the abdominal wall and also potentially everything in back as well too. A lot of my clients come in asking for a tummy tuck, but they don't realize that there's a number of tummy tucks available to them. So let's talk about the various types of tummy tucks. Starting with the most basic, the mini tummy tuck. The mini tummy tuck is a procedure that essentially addresses tissue laxity or loose skin below the belly button. A standard tummy tuck addresses the entire abdominal wall. An extended tummy tuck extends more laterally and more posteriorly. It means it goes towards the back. It's used for patients that have much more significant abdominal wall laxity. Let's talk mini tummy tuck. The mini tummy tuck is probably one of the most misunderstood tummy tucks that there is. Many patients would love a mini tummy tuck because they feel that the incision is smaller. That's not always the case. A mini tummy tuck in and of itself addresses skin laxity to the lower abdominal wall. It doesn't go above the belly button. Sometimes we'll go a little bit above the belly button by floating the belly button down, releasing that, and helping to pull down loose skin above the belly button. But there is no abdominal scar. And that's a big difference between a mini tummy tuck and a full tummy tuck. Many patients are not good candidates for the mini tummy tuck because most women and most men will have laxity not only below, but also above the belly button. Full tummy tuck. What is a full tummy tuck? A full tummy tuck is a tummy tuck or abdominoplasty, as is more formally known, that addresses skin laxity below the belly button and above the belly button. It's often combined with liposuction circumferentially. We call it 360 liposuction to create a more sculpted, uniform look. Not everyone does this, but this is something that we firmly believe in. We use liposuction and we use Renuvion skin tightening to help tighten everything around the tummy tuck itself. With a tummy tuck, we make a low-lying incision that's marked in your underwear line because you don't want everyone to know you've had a tummy tuck. You just want them to see the results. But let's hide the scar, so we do that in your underwear line. So a low-lying scar is made, or a low-lying incision, I should say, within your underwear line. An incision is made around your belly button as well, too, to release that skin. And then the skin is lifted up all the way up to the base of your ribs. Once that skin is lifted up, a series of sutures that are absorbable are placed going from the belly button up and down, and then from the belly button down and up. That effectively tightens the abdominal wall by bringing the muscles together. Let's talk extended tummy tuck. What is an extended tummy tuck? An extended tummy tuck is simply a tummy tuck whose incision extends farther back. It's a larger incision aimed at capturing more tissue. It's for those patients who've lost more weight, who have more excess skin, and who need more tissue along the side, resected and shaped. Let's talk 360 tummy tuck. What's a 360? Well, as the name sounds like, it's all the way around. Sometimes called a belt lipectomy, sometimes called a circumferential tummy tuck. The 360 tummy tuck is an amazing procedure as more and more people lose weight. But however you gain that excess skin and lost that extra fat, you now not only have excess skin in the front, but many patients we see have excess skin in the back and on the sides. That a simple tummy tuck or even an extended tummy tuck does not address. The 360 tummy tucks perform first with you lying on your stomach, where we effectively perform a buttock lift. A strip of tissue is removed from the back after we perform liposuction and Renuvion. So liposuction to remove the fat and Renuvion to tighten the skin. We then remove a strip of skin in the back, and that remaining tissue then is anchored so the scar does not stretch. Or if it stretches very little. Once that's performed, then we rotate you, and now we perform an extended tummy tuck and we connect the dots. We go from the previous incision all the way to the front and we form the 360 tummy tuck. So now that you've learned about the variety of tummy tucks available, what is the modified tummy tuck? Well, the modified tummy tuck often combines elements of all the aforementioned tummy tucks, but it's modified. Some of these changes, some of these approaches, we actually won't know until we get into the operating room and see how your tissue adapts. I recently had a case of this where a patient came in who had lost a fair amount of weight, had very little fat, so we did not perform liposuction Renuvion, but she had a fair amount of excess skin. but not enough that we thought we'd be able to form a complete tummy tuck. So in her case, we made the low-lying incision. We lifted up the tissue up to the level of the belly button. And from there, we flex the bed. So we bring patients forward so it reduces the tension on the tummy tuck incisions. But at that point, we realized that we could easily excise enough tissue, and we proceeded with the full tummy tuck. Had we not been able to do that, we may have had to do a modification. So regardless of what procedure that you think you may need, our recommendation is visit a board-certified plastic surgeon who specializes in tummy tucks. Because as I've found over the years, having performed hundreds and hundreds of these, not all tummy tucks are the same, and not all tissue is the same. We've really changed how the tummy tuck has evolved and what we can do with the tummy tuck. And that is the true tuck. The true tuck is different than all other tummy tucks. It gathers options from other tummy tucks and new techniques to bring forward a revolutionary way to approach your abdominal wall. So now that you've heard all this information, you've learned all about the different tummy tucks, you probably have a lot of questions. We would love to work with you. I'm Dr. Buford from Beauty by Buford. At Beauty by Buford, our goal is to keep you educated and to help you look your very best.